What if small changes to your daily routine could help you prevent those sudden and painful glaucoma flare-ups? It might sound unbelievable, but the truth is, many people with glaucoma unintentionally trigger flare-ups through everyday habits. Today we're exploring the 6 most common causes of these flare-ups and, more importantly, how you can avoid them. Glaucoma is a leading cause of blindness, and flare-ups can cause long-term damage if not addressed. But with the right knowledge and strategies, you can protect your vision and avoid these dangerous pressure spikes. Could something as simple as adjusting your routine really make a difference? That's exactly what we're going to find out. Stick with us, and by the end of this video, you'll have practical steps to safeguard your eyesight and preserve your vision for years to come. Glaucoma is a group of eye conditions that damage the optic nerve, often due to increased pressure inside the eye, known as intraocular pressure. This pressure can build up unnoticed, causing significant damage before symptoms appear. Unfortunately, many people have glaucoma for years without realizing it, and if left untreated, it can lead to permanent vision loss. For seniors, the risk is even higher. The American Academy of Ophthalmology estimates that 1 in 10 people over 60 have glaucoma, and the risk increases with age. The good news is that with early detection and proper management, most people with glaucoma can maintain their vision for life. Regular eye exams are essential for spotting glaucoma early when it's easier to manage. Flare-ups happen when there's a sudden increase in intraocular pressure, the pressure inside your eye that can damage the optic nerve. Think of it like overinflating a balloon. The more pressure you apply, the more damage it causes. If not managed, flare-ups can lead to severe vision changes, eye pain, headaches, and even nausea. These flare-ups can speed up the damage and, over time, result in permanent vision loss. Understanding what triggers flare-ups is key, and the good news is that many causes can be prevented with the right knowledge and strategies. By making a few adjustments or seeking proper treatment, you can avoid these risks. Now, let's take a look at the 6 most common causes of glaucoma flare-ups and how you can protect your eyes. Cause 1. High blood pressure, hypertension. High blood pressure is one of the main triggers for glaucoma flare-ups. Studies show that people with hypertension are more likely to experience these flare-ups. Uncontrolled high blood pressure causes fluctuations in intraocular pressure, which puts extra stress on the optic nerve, increasing the risk of damage. Not only does high blood pressure affect eye health directly, but it also reduces blood flow to the optic nerve, limiting the oxygen and nutrients it needs to stay healthy. Some blood pressure medications can also interfere with glaucoma treatments, making it harder to manage the condition. So, what can you do? The key is managing your blood pressure. Regular monitoring is essential, along with sticking to your prescribed treatment plan. Lifestyle changes, like reducing salt, exercising, and managing stress, are all effective in keeping your blood pressure under control and minimizing the risk of flare-ups. Cause 2. Non-compliance with medication, missed doses, or incorrect usage. One of the biggest causes of glaucoma flare-ups is medication non-compliance, and it's something we can control. Missing doses or not using your medications properly can lead to serious consequences. In fact, studies show that up to 50% of glaucoma patients don't follow their prescribed treatment. This can make a big difference in managing the condition. Glaucoma medications, like eye drops, lower intraocular pressure, but if you miss a dose or don't apply them correctly, the pressure can build up. It's like a slow leak in a tire. It may not seem urgent, but over time, it leads to significant damage. Missing doses can trigger flare-ups and worsen the condition. To stay on track, set reminders on your phone, or use a pillbox or eye drop dispenser. If you're having trouble sticking to the routine, talk to your doctor. They might adjust your treatment or suggest a more manageable option. Staying consistent is key to preventing flare-ups and keeping your glaucoma under control. Cause 3. Stress and anxiety. Stress is often overlooked when it comes to managing glaucoma, but it has a significant impact on eye health. Research shows that stress can increase intraocular pressure, making glaucoma symptoms worse. A study in the Journal of Glaucoma found a clear connection between high stress periods and elevated eye pressure in glaucoma patients. So stress doesn't just affect your mind, it can affect your eyes too. When you're stressed, your body releases cortisol, a hormone that raises blood pressure and constricts blood vessels. This increase in pressure can, in turn, raise intraocular pressure, triggering flare-ups. The good news is that stress management can help reduce flare-up risks. Simple practices like deep breathing, meditation, or yoga can lower cortisol levels and promote relaxation. Taking walks in nature and getting enough sleep are also great for both your mental and physical health, including eye pressure. Cause 4. Poor diet, lack of nutrients and hydration. A poor diet might not be something you'd immediately associate with glaucoma flare-ups, but trust me, what you eat plays a huge role in managing your eye health. A diet that's high in processed foods and low in essential nutrients can actually contribute to increased intraocular pressure, making it harder for your eyes to function properly. In fact, research has shown that a lack of antioxidants, like the ones found in leafy greens, can impair eye health and potentially worsen glaucoma symptoms. So if your diet is lacking in these key nutrients, it might be time for a change. An unhealthy diet can contribute to inflammation in the body, which can, in turn, worsen intraocular pressure. This pressure buildup is the root cause of glaucoma, and without a healthy diet, it can become harder to manage. Dehydration is another factor. When your body is not properly hydrated, it can cause imbalances in fluids, which affects the pressure inside the eye. All of these things together can increase your risk of flare-ups. But don't worry, there's a solution. The key is to make sure you're getting the right nutrients that promote healthy eyes. Start by consuming a diet rich in vitamins C, E, and A, all of which are vital for maintaining eye health. Foods like carrots, dark leafy greens, and citrus fruits are packed with these vitamins. Omega-3 fatty acids are another essential nutrient, found in fish like salmon and flax seeds, that can help keep inflammation at bay. And of course, staying hydrated is crucial, so make sure to drink plenty of water throughout the day to keep everything running smoothly. Cause 5. Certain medications and drugs. One often overlooked factor in managing glaucoma is the medications you're taking. Some over-the-counter and prescription drugs can trigger flare-ups, especially corticosteroids, commonly used for inflammation. Research in the American Journal of Ophthalmology shows that long-term use of steroids can increase intraocular pressure, raising the risk of flare-ups in glaucoma patients. It's not just steroids. Medications for high blood pressure, allergies, and even some antidepressants can interfere with glaucoma treatments or raise eye pressure. If you're taking any medication, it's important to check with your doctor to make sure it's not negatively affecting your eye health. Be proactive. Always discuss all your medications with your doctor, including over-the-counter ones. Your doctor can help you find alternatives or monitor your treatment to avoid any issues with your glaucoma management. Cause 6. Eye injuries or infections. Eye injuries and infections can trigger glaucoma flare-ups. Even a minor injury or infection can disrupt the delicate structures inside your eye, causing inflammation and increasing intraocular pressure. Conditions like uveitis, which causes inflammation in the middle layer of the eye, can lead to sudden spikes in pressure and worsen glaucoma symptoms. Even something as simple as an eye infection can affect the eye's drainage system, causing a rise in intraocular pressure. The higher the pressure, the more damage it can do to the optic nerve, making it harder to preserve your vision. To protect your eyes, always wear protective eyewear during activities that could cause injury, like sports or DIY projects. If you experience symptoms of an eye infection, such as redness, pain, or blurred vision, seek medical help immediately. Early treatment can prevent the infection from worsening. Lastly, regular eye exams are crucial, especially if you notice any sudden vision changes. Now that we've covered the 6 most common causes of glaucoma flare-ups, you're probably wondering, what can I do to protect my eyes and prevent these flare-ups? The good news is, there are several steps you can take to manage your glaucoma and safeguard your vision. Let's quickly recap the best strategies to keep your eye pressure in check and protect your sight for the long term. First, regularly monitor your blood pressure. High blood pressure is a major contributor to flare-ups, so keeping it under control is essential. Stick to your prescribed medication routine. Missed doses can lead to pressure spikes. Managing stress is another key factor since high stress can increase eye pressure. Stay active, eat a nutrient-rich diet for eye health, and get enough rest. Protecting your eyes from injury and infection is also crucial. Simple precautions like wearing protective eyewear can make a big difference. Most importantly, don't skip your regular eye exams. Early detection helps prevent irreversible damage and makes managing glaucoma much easier. You now know how to prevent flare-ups and take control of your eye health. By following these steps, adhering to your medication, managing your blood pressure, reducing stress, eating a healthy diet, and protecting your eyes, you're not only preventing flare-ups, but also preserving your vision for years to come. If this video was helpful, please like, share, and comment below with your thoughts or questions. I'd love to hear about your experiences and help guide you toward better eye health. Don't forget to subscribe and turn on notifications for more health tips. And if you're interested in learning more, check out the next video. Take care of your eyes. Remember, small changes can make a big difference.